CPT coding, one of the most complex topic is hand surgery coding. But it is not that much difficult if you know the basics. So in today's session, we will learn CPT complex hand surgery coding made super easy. In this session, we will learn few common hand conditions as well as its treatment. This session will be useful for the coders who are already working in same day surgery as well as coders who are planning to attend the interviews. After watching complete session, if you like this session, please click on like button in order to motivate me to provide more valuable videos like this. In hand surgery coding, carpal tunnel syndrome is the most common scenario we will encounter. In the operative reports, you will see it as CTS. So sometimes patient will not mention carpal tunnel syndrome directly. Basically, he will mention CTS. So you need to remember CTS means carpal tunnel syndrome. The most common symptoms of carpal tunnel are numbness, tingling, and weakness. And you will see this carpal tunnel syndrome in the palm side of the hand. In order to understand carpal tunnel syndrome, most important keyword in the operative report is median nerve. Whenever the median nerve compresses, we will get carpal tunnel syndrome. So this is the cross section. So this is the carpal tunnel. Okay, so this is the tendon sheath. Every tendon will be covered by tendon sheath. So these are the tendons. This tendon will be covered by tendon sheath. And here is the ligament. Okay, so this ligament will put all nerves and blood vessels united. Next, here is the median nerve. So if this median nerve compresses, patient will have numbness, tingling, and weakness. Now we need to understand why this carpal tunnel syndrome occurs. Basically, this is the ligament, carpal ligament. Okay, so if this ligament becomes thickened and tightened, so this ligament will compress this median nerve. Because of this compression, patient will have numbness as well as tightens and tingling. So, in order to treat this carpal tunnel syndrome, we have two CPT codes. First one is 64721. So, 64721 is the open approach. Next one is 29848. So, 29848 is the endoscopic approach. So, whenever you want to code carpal tunnel syndrome or carpal tunnel release, you need to check first whether it is open procedure or endoscopic procedure. In the open procedure using 64721, you will see the documentation where patient mentions I have created the incision at the wrist area on the metacarpal joints and I have identified the carpal tunnel. Then he will release the or decompress the median nerve by freeing the nerve. In order to decompress the median nerve, patient will remove the soft tissue surrounding the median nerve. Next one is 29848 endoscopic carpal tunnel release, where instead of open incision, patient will create small incision and he will insert the endoscope through those incisions. So this is about carpal tunnel syndrome, which is the most important procedure you will encounter during same day surgery coding. So if anyone looking for jobs in UAE, USA and India, please join in WhatsApp group. So our WhatsApp group link is in the description of this video. And if anyone looking for same day surgery training, IPDRG training, SEC coding training, CCS certification training, please contact 707-526-3939. Next most common hand condition is trigger finger. Basically, this trigger finger occurs due to tendon uncontrolled movement. During trigger finger, the tendon is unable to move forward and backward, which is because of formation of lunk in the tendon. Because of this uncontrolled movement, the finger will be in the bent position. So this is the anatomy of trigger finger. So this is the nodule. This is the A1 pulley. This is the flexor tendon. Okay. So because of this nodule, this tendon can't move forward and backward. And you need to understand flexor tendon is for flexing the hand. Okay. Extensor tendon is for extending the hand. So trigger finger most of the time complication of flexing of the hand or finger. We have only one code related to trigger finger, which is 26055. So if you see in your CPT book, directly you will get code related to trigger finger. During the trigger finger release procedure, patient will create incision on A1 pulley here. So because of this creation or position of the incision, this tendon will move smoothly from this area. So whenever you want to code trigger finger, your keyword is A1 pulley. Whether patient is performing A1 pulley release or not. You need to check A1 pulley release or incision on the A1 pulley. Next one is carpometacarpal arthritis. Usually we will call it as CMC. CMC means carpometacarpal. So this is the carpometacarpal joints. These are the carpal bones. This trapezium, scaphoid, trapezoid, capitate, hamate, pisiform, triquestrum, lunate, all these are carpal bones. So the joint between these carpal bones and metacarpals is called as carpometacarpal joint. Because of degenerative changes at the joint location, patient will have carpometacarpal arthritis. In the documentation, you will see it as CMC arthritis. Other name for this carpometacarpal arthritis is basal joint arthritis. Most affected area of this carpometacarpal arthritis is the meeting of trapezium with carpometacarpal joint. So here, if you see the affected area, it looks like cracks as well as bloody in coloration. So this is the normal articular cartilage. This is the arthritic cartilage. So we can see this cartilage everywhere in a joint. So what are the treatment for this CMC arthritis? Arthroplasty, interposition, intercarpal or carpometacarpal joints. 25447. So basically it is a open procedure where physician will remove the bone and he will place tendon instead of bone. So that is the process. So here arthroplasty means repair of the joint using the tendon, where physician will remove the affected bone and he will place tendon. This is the soft tissue, usually piece of harvested tendon or fascia is inserted place of the excised bone. So that is the procedure of 25447. Next we have Dupuytren contracture. So this is also one of the most important procedure we will encounter in ambulatory surgery coding. So basically Dupuytren contracture is the forming of knots under the skin. So whenever these knots will become thickened and they will pull the fingers, because of that finger will in the bent position. Most of the time we will see Dupuytren contractures in ring and small fingers. For Dupuytren contractures we have two codes, 26040 or 26045. So both are having fasciotomy, palmar. The approach is different. 26040 percutaneous approach, 26045 open approach. Here patient will perform the fasciotomy. So fasciotomy means incision on the fascia of the palmar or palm area. So what is important here? Whenever you want to code Dupuytren contracture, we need to check whether it is percutaneous approach or open approach. Next one is Quervain tenosynovitis. So basically it is the inflammation of synovial membrane of the tendon. So this is the inflamed synovial membrane. This is the extensor retinaculum, which is the thick tissue which will bind these membranes, and these are the inflamed tendons. So this extensor retinaculum will pick or bind all these tendons and synovial membrane. Because of this recurrent tenosynovitis, patient will have most of the time pain on the thumb area. So for This we have only one code 25000 incision, extensor tendon, sheath, wrist. So here patient will create incision on the affected area of the tendon. Next we have ganglion cyst, which is also one of the most important procedure we will encounter. So ganglion cysts are round or oval shaped jelly filled sacs. So these are the ganglion cyst. So this is external appearance, this is the internal appearance. Most of the time you will see in the joints or tendons of hands, wrist, ankles and feet. So basically you may find these cysts anywhere in the hands, wrist, ankles and feet. Okay, so other name for this ganglion cyst is Bible cyst. For ganglion cyst excision, we have two codes 25111 or 25112. For example, if the patient performs excision of ganglion cyst first time, 25111. If the patient performs excision of ganglion cyst second time, 25112. So for example, patient had ganglion cyst excision in 2020. Now 2025. Again, if the patient performs excision of ganglion cyst in the same area where patient has performed ganglion cyst excision in 2020, that time we will code this one. So this is first time, this is second time excision of ganglion cyst. As it is a open procedure, patient will create the incision and he will free from the surrounding tissue. So thank you guys. Thanks for watching this session. If you like this session, please click on like button. If you have any confusion, please mention in the comment section of this video.